Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Zonisamide. Its brand name is Zonegran. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Zonisamide. We'll then discuss examples of dosing and finish it off with side effects with percentages. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here will be the mechanism of action or how this medication works. So some in vitro studies suggest the mechanism of action results from a blockade of sodium channels with stabilization of neuronal membranes and suppression of neuronal hypersynchronization. In terms of indications or reasons we prescribe this medication to a patient, well, we would often see this medication prescribed as an adjunct or add-on therapy for the treatment of a partial seizure. With respect to contraindications or reasons we would not be able to prescribe Zonisamide, well, we wouldn't give this medication first off to a patient who had a hypersensitivity to Zonisamide or any other component of the formulation. As well, if a patient had a hypersensitivity to sulfonamides, they would also not use this medication. Now for examples of dosing with Zonisamide. So in the treatment of a partial seizure, again as an add-on or adjunct therapy, we would see an initial dose of 100 milligrams per day given orally. The patient would then have the option to increase the dosage by 100 milligrams per day every 2 weeks to the usual effective dosage range of 100 to 600 milligrams per day in 1 to 2 divided doses. If they were using this medication for an off-label indication, such as Parkinson's disease, we may see 25 to 200 milligrams given daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Zonisamide, so we'll go over some of those here now. 3 to 35% of patients may experience abnormal weight loss, and a loss of appetite seems to happen 13% of the time. 6% of patients may experience ataxia, and 13% may experience dizziness. Somnolence may happen 17% of the time, and up to 6% of patients may experience a lack of concentration or the inability to concentrate. Agitation may happen 9% of the time, and depression may happen 6% of the time. More serious side effects would be a rash happening 3% of the time, Stevens-Johnson syndrome, or heat stroke. Alright everybody, that's all we're going to talk about today with Zonisamide or Zonegran. As always, I'm very thankful you took the time to combine and watch one of my videos. If you find the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.